Abnormal bleeding after a natural miscarriage, signs and symptoms.
It's important to know the signs and symptoms of abnormal bleeding after a natural miscarriage. If you experience any of these, it's crucial to seek medical attention immediately.
What is normal bleeding after a miscarriage?
Normal bleeding after a miscarriage typically lasts for about 1 to 2 weeks and can be similar to a heavy period. The bleeding should gradually decrease in volume and intensity over time.
What are the signs of abnormal bleeding?
Heavy bleeding. If you're soaking through more than one pad or tampon per hour for several hours in a row, it may be a sign of abnormal bleeding. Large blood clots. Passing large blood clots, bigger than a quarter, could indicate abnormal bleeding or retained tissue. Prolonged bleeding. Bleeding that lasts for longer than 2 weeks or becomes heavier instead of lighter may also be abnormal.
What are the symptoms that require immediate medical attention?
Severe pain. Intense, persistent pain in the abdomen or pelvic area may signal an infection or other complications. Fever. A fever above 100.4 degrees Fahrenheit, 38 degrees Celsius, could indicate an infection, which requires prompt medical attention. Foul-smelling discharge. This may also be a sign of infection and should be evaluated by a healthcare professional. Weakness, dizziness, or fainting. These symptoms may indicate excessive blood loss and should not be ignored. It's essential to be aware of the signs and symptoms of abnormal bleeding after a natural miscarriage. If you experience any of the symptoms mentioned above, reach out to your healthcare provider immediately to ensure your safety and well-being.